Hi, this is Dr. Diane Chu with the Bellevue Laser Cosmetic Center. Does your double chin bother you but you've been afraid to do anything about it? Well, today I want to talk to you about Kybella. Kybella is this amazing new injectable product that's made of bile salts, and we inject it right into that double chin area and it permanently gets rid of your fat cells. The great thing about it is it literally takes minutes to do and there's no downtime. It can take 2 to 4 treatments a month apart, but literally you can just go back to your activities. It's not like liposuction where you're going to be, have a lot of downtime and there's any pain associated at all. So follow me and I'll show you what this product is all about. So this is my model Karen. Karen is a perfect Kybella candidate. She actually has had one treatment a month ago already, so her little double chin area is actually better than it was last month. But I'm going to show you why she's such a good candidate, because she's got this little area here that's just fat. She doesn't have a lot of laxity in her skin because this is not going to tighten up the skin that much. It will a little bit. Also, she doesn't really have any jowls because Kybella is not safe to inject the jowl area. So Karen's a perfect candidate. Like if you can just pinch this little fat pad right there, that would make you a great candidate for this procedure. So the first thing that we're going to do is just mark out the area that I'm going to be doing the injection. And then Karen, I'm going to have you turn this way. Okay, and turn the other way. Okay, good. And then relax. So as you can see, I have now marked where we're going to be injecting Karen. There's a couple zones that we don't want to inject into because there's a little nerve right here called the marginal mandibular nerve. And this is why we can't inject the jowl area, that if you hit that, it might cause a crooked smile. Now sometimes the Kybella can diffuse a little bit and you might get a temporary little crooked smile, but that always goes away. So I'm going to be where all of these little dots are. I'm going to be injecting the product into this area, and we'll show you that next. In terms of discomfort, Karen's already had some topical numbing cream on her for about half an hour. It's really not a big deal, and she'll describe to you how it's feeling. I'm just going to give her a little bit of ice and we're going to start going. So Karen's had a little bit of ice on her now for a few minutes, and we've also given her a couple of ibuprofen to take that helps with inflammation. And what I'm going to do is just do some injections. Here we go. And that is it. We are done. How did that feel?
It was great. Not a lot of pain or discomfort.
So that's it for Kybella. We're done with Karen's demonstration. It literally took like 2 or 3 minutes for me to inject her whole neck area. How does it feel right now?
It feels great, and this is my second treatment, like Dr. Chu said. After the first treatment, I had very little side effects and very little downtime. I actually went back to work the same day of my first treatment. I had a little bit of redness, some swelling for a couple of days, and some minor numbness, but that all went away prior to my second treatment.
So as you can see, even right now, she's starting to swell up a little bit. So I think that's the thing people complain about the most is swelling. Sometimes you can almost look like a little bullfrog for a couple of days. For that reason too, this treatment may not be the best for someone who has a hard time swallowing, because with that swelling, sometimes it can make you feel like you're having a little more difficulty swallowing. But otherwise, the side effects are really just bruising, swelling. Sometimes the fat feels a little firm and tender. You can take some Advil after, some ibuprofen, ice it, but really there's nothing you need to do. We use repeat treatments every 1 to 2 months, and you could do up to 5 or 6 treatments a month apart to really get the full benefit. The cost, it depends on how much Kybella we need to inject and how much fat you have, but it's otherwise very, very simple to do. So come in and we can take a look at you and help you decide if you're a good candidate for this procedure. Thanks for watching.